Hi everyone, Dr. Nemechek here. I give you a little pointers on COVID and that chronic cough you have. Now it's well known that serious COVID infections cause serious lung damage, right? This is typically from uh, many blood clots hitting the lung, or even originating in the lung for that matter, and it can cause some permanent lung damage for sure. But in the majority of outpatients, in my experience, we've seen a number of like long haulers here. Uh, the chronic cough is a very simple thing. It's actually a low-grade sinus infection, and this can go on for months, believe it or not. But the problem is everybody's thinking lungs. So the patients typically, they've been here, they've seen a pulmonary doc or their primary care, they've had CT, chest scans, they got pulmonary function tests, they blah, 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 blah. That, all this stuff, lung, looking in the chest. Can't find it. All right. And so the big clue for the cough is, from sinuses, is does it kind of get worse when you lay down? Do you start coughing a little bit when you lay down, maybe, 10, 15 minutes before you're able to go to sleep? Or when you wake up, does it start, you cough a bit when you get up, maybe after 30 minutes, a cup of coffee or something gets a little bit better? Those are real big clues for sinus infections, post-nasal drainage. All right. Now, and then what I use for this is basically nasal steroid sprays. That's my first thing. And so you use Flonase. The generic is called fluticasone. One spray in each nostril twice a day for about 10 to 14 days it has the same efficacy as amoxicillin or Z-Pak in reducing a sinus infection. So boom, right there, you go to the store, you can buy the generic brand at the pharmacy, start that. Usually people can start feeling better. It takes a couple days for Flonase to fluticasone to work, and so you probably don't have full effect maybe day 3 to 5, somewhere in there, and you'll be shocked. I would say it's 9 out of 10 get better with just that. And then the remaining one, or here's what happens: you get better, you stop, and then it kind of comes back. It doesn't mean it didn't work. It means it didn't fully heal and allow the sinus to drain. So you get back on the Flonase for another couple weeks and give it finally enough time to heal so that when you stop, these symptoms stay away. If that keeps persisting coming back, or if the Flonase doesn't work, then what I do is those are the people I give a short course of antibiotics to. Whether it's 5 days of azithromycin, that's a Z-Pak, or 10 days of doxycycline or amoxicillin, something like that. Now again, if you get better, that means you had a sinus infection, and if you stop and it returns, that it really means you had a sinus infection. It's just harder to treat, and then your doctor's going to have to give you a longer course of antibiotics. But it's a very common thing. It's missed all the time, and you won't even know that you have post-nasal drainage. I've asked so many times in my career, you ask patients, do you think you have any post-nasal drainage? Do you think that could be causing the cough? And the patient say, nope, none. And you do an exam, you look in the back of their throat, sheets of goobers coming down. Okay? So just trust me, give it a try. If this has been lingering, it's driving you nuts, just go get some Flonase. You'll know in a week or so if that's what it is, and more likely it'll be gone. So I hope you find that helpful. Lots of people getting COVID out there. It's still dangerous. It's still causing injuries every time you get it. If you're in crowded space, closed space, wear your mask, and try to cut down on the number of times you get it. It'll do you well in the long run. Take care now. Bye.